Welcome to lesson number 4 of module 1 of the Healing Brain Masterclass, Treating Cannabis as Medicine. I'm your host, John Malanca of The Sacred Plant, and thank you for being here. Let's talk about cannabis as a medicine. Interestingly, we typically think of medicine in a pill bottle, and as such, treat it differently. We have a whole medicine cabinet for them to be stored in. We caution against children touching the medicine, keeping it safe, dry, and in cool temperatures. In just a minute, Dr. Stein will elaborate on how we go about treating cannabis as a medicine, including a brief understanding of dosage and how it affects you. So welcome back, Dr. Stein, first off, and thank you for your knowledge thus far. Can we talk about cannabis as a medicine and how people how you treat it as a medicine, that it is a medicine?
Cannabis is certainly a medicine in our clinic. Of course, patients or individuals use cannabis for recreation. That's their decision. But when they come into our clinic and they're seeking my advice, we treat it like any other medicine. That means that we have to understand what is the symptom or problem we're treating specifically, what the patient's preferences are in terms of route of administration, and what I believe is an efficient route of administration, the amount in milligrams, dosing, the combination of cannabinoids and terpenes. All these things have to be taken into account in addition to the other medications they're on, maybe their lifestyle, family support. All these things go into treating a medication like a medication. There's a lot of factors.
And then you mentioned, family support, which I think is really important, but also cannabis is not a one-size-fits-all. And what works for you, if you and I have the same ailment, might not work for me. And so what I've seen with other doctors as well as, they look at age, weight of the patient, the current health condition of the patient, and then also what other medications they may be on, and then assessing a protocol and dosage specifically designed for the patient as cannabis as a medicine.
Prior cannabis use is very important. Does the individual patient have experience with cannabis? Maybe they had a bad experience with cannabis. Maybe they're having good experiences. Are they self-medicating? We consider all those things and come up with a plan, a treatment plan. And that plan is usually fluid because there is a dynamic. When patients start using cannabis, the initial effect may not be what we want as a final effect. There's usually a titration or dosing period where we adjust the amount of medicine they're taking.
So we know how important it is to work with a doctor, and we've recommended this numerous times over the years here in the Sacred Plant, and why it's important to work with a doctor on dosing and protocol and formulation and guidance. But what about the patients that say, nothing wrong with it, but that want to do it on their self-medicate, go out and do it on their own. Now with the laws in California being recreational legal, you have to be 21 and over. And so a lot of people are avoiding the doctor visit, one, to save cost, or to say, hey, I can go down there on my own. But what do you say? Can you overdose on medical cannabis? Can you overdose on cannabis? I'll just say that.
You can't die from an overdose of cannabis. You can have an unpleasant experience. And if individual patients or individual people want to use cannabis on their own to either relax or treat pain, that's their choice, if that's allowed in their state. If they are unable to achieve the kind of result they want from their cannabis use, ask a professional. Consult with a doctor, talk with people at the dispensary, do some research. So I'm confident that almost all patients can achieve some degree of success with cannabis therapy, as long as they are willing to adjust the dose, give it some time, assess feedback in terms of reaction to the medication, and be a little patient, get to the place they want to be. I try to inspire confidence that we can have success with almost everybody, at least to some degree.
In your practice, how do you assess what is a proper dosage for each and every one of your patients?
Well, there's a variety of sources of information that helps me determine what dose someone needs. If they have prior cannabis use or current cannabis use, we can usually go a little higher with the medicine.
Okay.
If they are cannabis naive, we have to go very carefully. We have to start low and go slow, as they say. But as Dustin said the other day at a meeting I attended, start low, go slow, but don't be afraid to go all the way. And that's important because patients sometimes over the first 3 or 4 weeks of their therapy notice that with increasing dose, they finally get to where they want to be.
Yeah.
If they don't get there and they give up prematurely, they say cannabis doesn't work for me, that's a treatment failure, but it doesn't have to be. So when someone comes in, we ask carefully about their cannabis experience. We talk about how they want to use the medication and how the dosing affects them. So, for example, when we had a Q&A the other day, someone was getting some relief by using a capsule in the morning, but that benefit was wearing off by nighttime. And the solution, which seemed simple at the time, was, okay, you need to take a capsule earlier in the day, so the medicine, when it wears off, you have another medication dose available to you. This is standard adjustment that we need to incorporate in our medical cannabis clinic recommendations.
So in your practice with your patients, are there ways to see if this cannabis protocol is working without having scans or testing?
For almost all of our cannabis patients, we do not do formal scans or testing. Okay. We do follow-up visits here in the clinic. We have phone interviews. We follow up with them and communicate also by email. The best measurement of success with cannabis therapy is how the patient feels. And we can assess that by talking with them. Sometimes we need to talk with their caregiver. If the patient, let's say, can't talk or has dementia, we talk with the family about whether or not the therapy is working.
You know, since you don't do scans and you trust the patient when they come in here, do you ever incorporate, body scans, waking up in the morning, see how you feel, how you felt yesterday, how you feel today? And I think it's great even for healthy patients, caretakers, caregivers, spouses, family. Wake up, see how your body is. And so is that another way that what you share with your patients, just to take your internal body check to see how you feel?
Being mindful of symptoms is very important. I believe it actually enhances the effectiveness of the therapy because you're tuned into what you want to achieve, and there's a bit of a positive attitude, maybe even a placebo effect. Yeah. But being mindful is very important, yes. We use, in some patients, a logbook. We give them a logbook, and they record which cannabis they used, what time, and what the result was. So they can look back on that later and replicate that if they need it, the particular dosing, for example. I also encourage my headache patients to keep a headache diary. Again, this is useful not only for having them become more tuned into their symptoms, but for when they come back to the clinic, we can look at it together. Yeah. Some patients overestimate suffering in retrospect. I had a terrible month. And then we'll look at the diary together and be like, well, this is better than the previous month, actually. So we do those kinds of recordings on paper and logbooks. I do ask them to be mindful, and again, about the family members. Yeah. That's important.
Yeah. And I liked earlier how you mentioned Dustin, and the way I translated that at first was the way I translated it differently afterwards, but go slow.
Start low.
Start low, go slow, but don't be afraid to go all the way. And, at first I'm like, okay, and I know Dustin, and he's been on the show numerous times, and so I'm like, okay, it's not, how did Dustin's mind translate this? And I can see Dustin doing it quite a few ways, but the way I looked at it is, don't be afraid to go all the way. Meaning, continue on with your protocol that you recommend with your patient. Write down, take notes, see how you're feeling, and follow, and truly stick to this. Don't just do it for a week and say, I'll try it again in 3 weeks, which a lot of family members do. And I talked to family members as well as other patients, and they said, we're going to try this first. And if that doesn't work, we're going to try this. And so I just think it's okay to combine one. Don't be afraid. Go all the way and try this protocol. It's safe. It's healthy. In a lot of cases, a lot less expensive than some of these other conventional treatments that may or may not work. So why not try something that's healthy right here and do that? And so that's the way I look at it: is go all the way. Don't be afraid to go all the way. And you can translate however you want on this. Either go low, go slow and low, and say, you know what, just bring it on. Let me just see how I react to it as well. So, well, great, Dr. Stein. Thank you for that. And I know it not only helped me, but I'm certain it helped our listeners as well. And so, on to the next.
Okay, John.
Right. Personal checks are such a great practice. Taking a minute each morning of your day to take that mental record. How are you feeling? How do you compare to yesterday? What additional ways do you need to take care of yourself if you're feeling out of sorts? In my opinion, this is a very important part of anyone's day, whether dealing with a disease or ailment or just maintaining a healthy life. And in today's digital world where there is an app for everything, there are some great applications that help you track your basic vitals. Continuing on in lesson number 5, discussing medical cannabis with your loved ones, we will talk through what other patients have done to bridge this conversation and the various ways I help build confidence in patients so they can share more about their treatment plan and goals with their loved ones.